Roseland Community Hospital administrators are calling for more state funding to keep the struggling Southside Hospital afloat. They say COVID has exacerbated the hospital's financial need, due in part to added expenses in equipment and paying overtime for healthcare workers. The move comes as 4 other safety net hospitals have closed their doors on the south or west sides since 2018. Here to discuss this and more is Tim Egan, President and CEO of Roseland Community Hospital. Tim, welcome back. We spoke to you 2 years ago when Roseland was already facing financial challenges just as COVID was ramping up. How would you describe how the hospital is standing financially right now?
We're in financial difficulty. There's no doubt about it, even more so than we were 2 years ago. We had a great fight. We created our own testing program for the South Side through Roseland Community Hospital. That was an epic effort and just a tremendous change in the curve of COVID in the beginning. But this last round of Omicron really wounded us. You mentioned the added expense. We're about $6 million in debt right now to nursing agencies alone. And that has been crippling to us in our budget.
$6 million in debt to, you say, nursing agencies alone, agencies that help you staff your nurses in the hospital, correct?
Absolutely. That our COVID numbers soared during Omicron. We had a shortage of nursing, just like every other hospital across the United States. We had to plug those holes, and we had to use nurse agencies. And during the first stages of COVID, it was understandable to pay $10 or $15 more per hour for these agency nurses. But then the agencies took advantage during the Omicron variant, and they raised their hourly wages by almost 200% in some areas. And it's been absolutely devastating.
And so how much total would you say is needed to keep the hospital afloat?
Well, we're going to have to figure out a way to solve that $6 million debt there. But then we've got other programs that have been, that we've had to shut those programs down, like our adolescent behavioral health unit. To have those things put on pause, we need an influx of funding to get those programs back up and running and expand the rest of the services that we have, including a sickle cell anemia clinic.
So in response to Governor Pritzker's budget proposal last month, State Senator Emil Jones, whose district encompasses Roseland, he called for more investment in safety net hospitals, saying, quote, "Safety nets make up 19.1% of our state's hospitals and care for our state's most vulnerable populations. We must ensure that they are funded properly and equipped with adequate staffing and resources. I urge the governor to release the $30 million from the American Rescue Plan funding for safety net hospitals and hospital transformations." So what has the state and federal investment looked like throughout this pandemic for your hospital?
Well, in the beginning, the federal influx of funding was outstanding. We got a PPP pool of money that we immediately, that's the payroll protection plan. When we got that money, we immediately turned it over to all of our employees. Those heroes that were on the front line, they got hero pay. But that has now dried up. And, the rest of the ARPA money that's sitting there, we got some of it through COVID, but a lot of it's still sitting on the sideline. So, as tired, as frustrated, as angry as I am, we are forced to beg down in Springfield every spring just to keep our doors open.
What more? Well, I was going to ask what more needs to be done to protect safety net hospitals such as Roseland. What are you asking for in Springfield?
Well, as an outspoken safety net leader, I have a target on my back. And if that target puts money in Roseland's bank, then I'm willing to die on my shield for Roseland Hospital and other safety net hospitals. But that makes me optimistic. There are pools of money that are available right now. We don't need another tax. We don't need a casino. We don't need more marijuana sales. The money is there right now. And you mentioned transformation. That's what we're pushing for right now. We have had a transformation plan that's been pending with the state of Illinois since April of last year. And that's a $40 million investment over the next 5 years. So we can expand our behavioral health services, so we can bring an orthopedic surgery program to Roseland, and expand our behavioral health to include sustainable healing centers for adolescent patients suffering from behavioral health issues. That transformation is absolutely critical for the future of Roseland Community Hospital. And it has a broad range of support from elected officials like our hero that you just quoted, Senator Emil Jones III. What a champion, unmatched.
Well, why do you think those funds haven't been released and you haven't seen them?
Well, some of them have been released to some of the other pilot projects, but we're still waiting for ours. And that broad range of support that we have is from those elected officials, other healthcare providers, the medical district commission has given it. Even Aetna Better Health supports our transformation plan. One city planner came out and looked at our transformation plan and said it would be a sin if Roseland doesn't get this transformation plan funded from the state.
And Tim, before we let you go, obviously another concern for hospitals has been this ongoing worker shortage. As you mentioned, COVID cases are on the decline. Are you seeing more nurses and doctors return to work? What's your status there?
Well, not yet. We are absolutely heavily recruiting. We're offering sign-on bonuses, increase in wages. We haven't had that influx of nurses back yet because, a lot of these nurses that left the Chicago area, they were getting sign-on bonuses of $25,000 in Texas and travel expenses, living expenses. So they were going, where the highest bidder was. So we haven't seen them come back yet, and we're prayerful that these nurses do come back. I will give the state of Illinois 1,000% credit for one of their programs, and that was their pool of nurses that they helped provide for safety net hospitals. We had about 36 nurses come through and help us in the last 3 months from the state of Illinois. And without that, we would have absolutely had to shut down operations. So the state of Illinois really came to our aid and rescue. And I give them 1,000% kudos for that.
I'm sure the Roseland community is appreciative of that. Tim Egan at Roseland Community Hospital, thank you so much for joining us.
Thank you.